we decided to take surgery to the underserved parts of the country by means of an operating room built on a truck.
Dr. Edgar and Mrs. Dolores Reinbach Rodas are founders of the Cinturandis Foundation, a visionary mobile hospital and rural healthcare project based in Ecuador. Together, they travel that country performing surgeries and promoting self-developed programs that focus on clean water, nutrition, and preventative health education for those in the most distant areas. Born in Cuenca, Ecuador, Edgar graduated from that city's medical school in 1961. He completed a fellowship in general surgery at the Herbert Jerome Research Foundation in Miami Beach, Florida, and performed his surgical residencies aboard the SS Hope and at Washington Hospital Center in Washington, D.C. The Hollywood, Florida-born Dolores met Edgar while she was a student in the Mount Sinai Hospital School of Nursing in Miami Beach.
When I came back from the States, one day the priest called me and says, "Your friend said that he needs you because his daughter is very sick and he wants you to go and see her." That meant 12 to 15 hours to get to his community. So I said, okay, we have to go, and asked him a little bit. He said that the abdomen was swollen, that she was pregnant, and she had fever and chills. So I figured out that she had an abdominal infection. We took everything thinking we could do an operation. We went by car to the coast, and from there we started to climb the mountains by horse, and we made there around 1 or 2 o'clock. Unfortunately, she was dead. She was a very young woman, probably 25. And I tried to listen the heart of the fetus, but couldn't hear anything. It was dead also. She was still warm. That was a day very important in my life because I decided I have to work with these people all my life and go to the most distant places.
Their Cinturandis Foundation was founded in 1994 to aid the some 5 million Ecuadorians that live in rural areas with limited access to health care. The cultural makeup of that country is as varied as its terrain. 17 ethnic groups reside in Ecuador, speaking at least 10 different languages. In the Andean region of Ecuador alone, communities are spread from sea level to as high as 13,000 feet above that watermark. So that they could quickly reach the most remote areas to serve the impoverished residents, the couple developed a surgical mobile hospital. A self-contained operating room on wheels, it has enabled Edgar and other physicians to perform complex surgeries in regions that have little or no medical facilities. Edgar estimates that Cinturandis has performed more than 5,000 surgeries and has never lost a patient. Yet in order to really make a difference, the couple knew that Cinturandis needed to focus on more than just reactionary surgeries. Using the trust they've built with successful operations, Cinturandis doctors and nurses today promote fact-based Western healthcare and prevention in areas that have known only traditional treatments. Each group of doctors is assigned families in a defined geographical area.
¿Sí sabe lo que es el Papa Nicolau?
Sí.
Sí, pero nunca se ha hecho.
No, también primera vez.
Ah, así se hizo.
¿Cómo sé yo? No.
No, usted no, pues. Solo la señora.
Ah, ya, disculpe.
No, es que el Papa Nicolau solo se hace en las mujeres.
Eso.
For his efforts, Edgar has been named recipient of the Surgical Humanitarian Award by the American College of Surgeons in 2009, the Order of the Great Cross by the Ecuadorian government in 2002, and the Award to the Scientific Merit by the Ministry of Health of Ecuador in 2004. He also served as Minister of Public Health of Ecuador from 1998 to 2000. A professor of English at the University of Cuenca since 1982, Dolores has also served as a professor of postgraduate surgical residency at that institution.
For the general public, health is just the absence of disease. To me, health is related with every human activity.
Sinter Randy's mobile operation also includes a floating operating unit. It took the Rodas 15 years to get support from the Ecuadorian government so that it could reach out-of-the-way communities along the Amazon with this surgical boat. After 18 months, the government pulled its backing, but the Rodas remained committed to the project, knowing that it is yet another piece in a never-ending puzzle.
I think many times you don't see the results, or the results you see much later. But I strongly believe that every effort produces results. Some results will be after I die, but I think still will be results.
For working side by side to improve the lives of Ecuadorians, the Medical Mission Hall of Fame is proud to welcome Dr. Edgar and Mrs. Dolores Reinbach Rodas as part of the class of 2011.